Hello, am I audible? Hello,
हो मॅम.
hello.
हॅलो मॅम.
आवाज येतोय का माझा?
हो मॅम.
ठीक. Shall we start? Okay. What we have learned yesterday? About which type of disease we have learned? Which type of disease?
Epidemic disease.
Yes, epidemic disease. What we have to do in the epidemic disease?
We have to observe several patients
Huh?
and we have to examine number of patients, and then we can declare this is epidemic disease.
Yes.
And also we can find a remedy or miasm also.
Right. Which miasm is responsible?
SORA, acute SORA.
Right. Acute SORA is responsible. So if the same disease, same signs and symptom and the same totality with the several number of people, then that collective disease, we called it as a epidemic disease. So that we have seen. That what we have seen in the 101, how the complete picture is formed.
Means all are having same symptoms, same cause, diagnosis is also same.
No. How we can conversant with the totality of the symptom? By careful observation of several patients, because the miasm will not be manifest the same symptom at one patient, and hence we have to see the number of patients. In the
Number of patients.
We will get the some symptoms. In the second patient, we will get another symptoms. So in this way, we will conversant when we examine the several number of patients, so that we can form the portrait of the disease. So that we have completed in the 101 and 102. 103 काल आपलं अर्ध झालं होतं ना?
हो मॅम.
रेकॉर्डिंगचं साइन दिसतंय ना तुम्हाला?
हो दिसतंय मॅम.
थोडं लक्ष ठेवत जा त्याच्याकडे, कारण कधी कधी रेकॉर्डिंग बंद पडतं. Okay. Again we will read this 103 in the same manner. That means by examination of the several number of patients that we are taking in the epidemic disease. Why we are taking the large number of people in the epidemic disease? Because by definition, what is the epidemic disease? The large number of people affected in the different places. That is the epidemic. And the cause is same, signs and symptoms are also same. But what is the difference between the sporadic and epidemic? In the sporadic, 2 to 3 people are affected. People are affected in this area, then nearby area, then 100 kilometer area. So here and there, the people are affected. But in the epidemic, the large number of people are affected with the same signs and symptoms in a one particular area. Then बहुत सारी जगहों पे बहुत सारे लोग एक साथ अफेक्टेड होते हैं. So that is the difference between the sporadic and epidemic. Sporadic में कम पीपल अफेक्टेड होते हैं और बहुत ज्यादा डिस्टेंस पे अफेक्टेड होते हैं. बट एपिडेमिक में बहुत ज्यादा लोग अफेक्टेड होते हैं एंड द डिस्टेंस बिटवीन द ग्रुप ऑफ पीपल इज अगेन लेस. So what we have learning in the epidemic disease, generally it is of acute character. लेकिन ये acute character जो है, it should not be converted into the chronic malady, क्योंकि ये chronic malady का cause is the miasm. Here also in the epidemic disease, SORA is responsible. We have to investigate this acute character, the miasmatic chronic maladies के लिए who is responsible? So the SORA is responsible. So we have to investigate the whole sphere of the symptom. We have to complete that circle. And for that, we have to check every patient which are exhibiting the portion of their symptoms. The second person will show the second portion, the third patient will show the third portion, and so on. So in this way, we have to add all the symptoms of the SORA miasm which are manifested in each patient. Yesterday, I have given the example of coronavirus, that is the COVID की presentation कैसे कैसे scientist को समझ में आए, that I have given you example. So in this way, we have to collect all the symptoms. And especially of the SORA can be ascertained from the observation of very many single patient affected with a chronic disease, and without complete survey and collective picture of these symptoms, the medicine capable of curing the whole malady. So a single patient say this is not possible. हमको अगर SORA के सब symptoms collect करने हैं, so we have to collect all the manifestation of the several number, यानी बहुत सारे patient को collect करने पड़ेंगे, and then we are able to cure the whole malady homeopathically with the help of antisoric medicine. Without that, we cannot discover any medicine. And these medicine are at the same time two remedies. So जैसे हमने arsenic की Genus epidemicus निकाली है, किसी ने जिंकम मेट निकाली है, तो किसी ने कैम्फोरा निकाला है for this coronavirus. So why arsenic they have selected? Because of anxiety, because of fear of disease, because of fever, because of cough and coryza due to the cold weather. They are taking all these modalities. So some physician has detected or deduced the arsenic. Some have seen that it is a zincum mate. Because of the deficiency of the certain minerals, the immunity became low, and that's why they have selected the zincum mate. Again, the prostration is there, weakness is there. So in this way, the many physician has found their totality and they deduce the one medicine. And so that became a two remedies for the several patients. So किसी को arsenic से ठीक हुआ है, कोई कैम्फोरा से ठीक हुआ है, कोई एंटीम टार्ट से भी ठीक हुआ है. So that became a two remedy for the different type of patients suffering from the chronic affection. So in this way, again in this 103, he explained that how the miasms are responsible for any type of epidemic diseases. What is our duty? We have to take the portion of the manifestation of that miasm from each and every person. Then we have to do the collective totality and then repertorize the case, find out their medicine. That medicine can become a remedy for that particular patient. Clear?
Yes, ma'am. Yes, ma'am.
Read this 104. Sonia, read. Sonia is not here. Priyanka Lat. Alicia.
Yes, ma'am.
Read.
Okay.
104 aphorism.
Yes. When the totality of the symptoms that specially mark and distinguish the case of disease, or in other words, when the picture of the disease, whatever be its kind, is one accurately sketched, the most difficult part of the task is accomplished. The physician has then the picture of the disease, especially if it be a chronic one, always before him to guide him in his treatment. He can investigate it in all its part and can pick out the characteristic symptoms. In order to oppose to disease, this that is to say to the whole malady itself, a very similar artificial morbific force in the shape of homeopathically chosen medicinal substance, selected from the list of the symptoms of all the medicines whose pure effects have been ascertained. And when during the treatment he wishes to ascertain what has been the effect of the medicine and what change has taken place in the patient's state. At this fresh examination of the patient, he only needs to strike out of the list of the symptoms noted down at the first visit those that have become ameliorated, to mark what still remain and add any new symptoms that may have supervened.
Okay, thank you. So when the totality of symptoms that specially mark and distinguish the case of the disease, यानी जब आपने वो totality बना ली है from the collection of the different types of symptoms from the different patient, now in other words, the picture of the disease is now ready because the totality is the replica of the all the peculiar symptoms of the patient. This is the only thing on the basis of which we can take out the medicine. And hence he said that now the picture of the disease is complete. Whatever be its kind is once actually sketched. So once your totality is formed, the sketch of the picture is ready. The most difficult part of the task is accomplished. That means once you have done the totality, the difficult part is now over. Because when we are forming the totality, once you have well equipped with all the signs and symptoms of the patient, when you are having all the characteristics and peculiar symptom, अभी patient के पास बताने के लिए कुछ भी नहीं है, सबके सब signs and symptoms आपने patient से collect कर लिए हैं. After that, now you can have an idea कि अभी ये totality मेरी बन जाएगी, because what we are considering in the totality, we know, we have learned in the totality. We are taking into the consideration the cause, location, sensation, modality, characteristic, concomitant, then the accessory symptoms, mental symptoms, particular symptoms, all the things we are taking into the consideration where we are making the totality. So that is the most difficult task in our selection of the remedy. And hence, Dr. Honeyman said that once the totality is over, that means the picture of the disease is complete. That means your most difficult part of the case taking, this task is now over. The physician has been then the picture of the disease. Now you are having a complete picture of the disease, especially if it is a chronic one. Always before him to guide him in his treatment. So this totality will guide you in the treatment. He can investigate it in all other parts and can pick out the characteristic symptoms. अगर आपको लगता है तो again you can take out the some characteristic symptom even after the totality. In order to oppose to this, that is to say the whole malady itself, a very similar artificial morbific force in shape of homeopathically chosen medicinal substance. So most characteristic symptoms हमको लेने हैं in the totality so that we can choose the medicinal substance very easily. Selected from the list of the symptoms of the medicine whose pure effect has been ascertained. तो एक बार टोटलिटी आपकी फॉर्म हो गई है. टोटलिटी में आपने कैरेक्टरिस्टिक सिम्टम्स ले लिए हैं एंड इन दैट you have considered peculiar symptoms also. So now the picture is completed. On the basis of that, you can ascertain a medicine whose pure effect is known by the drug proving. And when during the treatment, आपने उसको medicine दे दी. During the treatment, he wishes the ascertain what he has been effect the medicine. What you will wish कि मैंने totality बना ली. Picture of the disease is now completed. Now I am able to select the medicine. You have given the medicine to the patient, and now you are expecting the certain changes in the patient. What change has been take place in the patient state? Medicine आपने कैसे दी है? Which is whose pathophysiology या pathophysiological जो effect है वो आपको पता है during by the drug proving. तो वही मेडिसिन आपने पेशेंट को दी है. नाउ यू आर एक्सपेक्टिंग द चेंजेस. सो सर्टन चेंज उसमें होंगे एंड फ्रॉम द डिसीज स्टेट नाउ द पेशेंट विल बिकेम अ हेल्दी स्टेट. At this fresh examination of the patient, you only need to strike out the list of symptoms noted down at the first visit. Those have become ameliorated. So patient को आपने medicine दे दी, patient फिर से आपके पास आया, आपने उसको पूछा how are you now, how many symptoms are now ameliorated, how you are feeling. So जो भी amelioration है, जो भी symptoms आपके पास लिखे हुए थे totality में, you just mark it कि ये amelioration में चले गए. And those are remain, उसको सर्कल बना लेंगे कि ये सिम्टम्स अभी रह गए हैं. एंड इफ एनी न्यू सिम्टम्स आर एडेड वो भी आपको सुपरवेन करने हैं. सो इन दिस वे एक बार टोटलिटी हो गई तो आपका आगे का काम बहुत इजी हो जाएगा. सो व्हाट इज द प्रोसीजर फॉर द एपिडेमिक डिसीज? इफ देयर इज अ एपिडेमिक वी हैव टू check the large number of people. We have to take all the signs and symptoms which are present in all the different person, because the myxome will not manifest all the symptoms in a one person. According to their immunity and the susceptibility, it will represent. So it is our duty to take out all the signs and symptoms by examination of several number of persons. After examination, once you are fulfilled with the same cause, the same disease, the same manifestations, and the same totality of the symptom, make one totality. Once your totality is found, that means the picture of the disease is now completed. You are well equipped with the characteristic symptoms. Now you are able to select the medicine whose pathophysiological effect we know by the drug proving. Give the medicine to the patient. Wait and watch. When the patient will comes to you, he said that the symptoms are ameliorated, take it. If he said that these symptoms are remain, mark it. And he said that new symptoms are there, add it. So in this way, you have to categorize amelioration, addition, and aggravation. So whatever may be the change which is occurring in the patient, you have to observe it properly. Clear?
Yes, ma'am.
So this completes up to the case taking from the aphorism number 83 to 104. We have completed the case taking portion. Any problem in this, in all these aphorisms? 83 to 104.
No, ma'am.
No, ma'am.
Because from 105 we will start the new portion. That's why I am asking. Do you want a revision or shall I take the class test on this class taking exam, case taking? What do you want? Because today is Saturday. So tomorrow you will get the time to learn, and on Monday, Monday, we will take a small class test on this case taking from aphorism 83 to 104. What do you suggest?
Ma'am, test means writing का oral?
नाही, रायटिंगचं. ओरली आपल्याला येतं, रायटिंग महत्वाचं आहे. जसं आपण लास्ट टाइम घेतलं होतं तसंच.
हा, म्हणजे तुम्ही क्वेश्चन देऊन आम्ही लिहून द्यायचं
आणि मग एका तासात ते सबमिट करायचं. आपण लास्ट टाइम केलं होतं तसं.
हा.
So for that, do you want a revision again or you will do it?
Ma'am, revision.
But in the revision, you should be participated. हाँ, मैं आपके लिए बड़बड़ नहीं करूँगी. I will ask you the small question. You have to answer me. So just we will take a fast recap of the previous aphorism and then we will move forward for the 105. Okay. So first of all, what is the definition of case taking? So case taking is the individualizing examination of the patient for a particular disease. Clear? Say yes or no.
Yes, yes.
So which is given in the aphorism number 83. Now the general guidelines are given by Dr. Hanim. So what is the first general guideline? Definition I have given you. Okay, this is the individualizing. Individualizing means what? What do you mean by individualizing?
Means examine the case properly.
Of each and every person. So this is the definition. The individualizing examination of the patient of that particular disease, that is known as the case taking. So what is the first general guideline for this? The physician should be prejudiced. He should not be a prejudiced one. He should have all the sound. He should use all his senses. He should observe it properly and he should trace out the picture of the disease with the help of his sound senses. This is the role of physician in the case taking, which is given in the aphorism number 83. Now the second point, what he has given. What he said, what is given in the 84?
General rules and observations.
No.
Do's and don'ts, source of information.
Yes, that is the source of information. Who is the source of information? Patient, attendant.
Patient, relatives or the friends, physician.
And what he advises here for the two things he advises here for the physician.
That physician should not interrupt the patient.
Right.
And advise to speak slowly.
Yes, and so that he can write down all the things by the patient. Third thing what he has given, we should notice, we should see, we should hear, and we should remark by all our senses the unusual characteristic about that person. If some bad smell is there, if some injury is there, if the patient is behaving abnormally, if the patient is talking too much. So all these things we have to observe and write accurately about that patient. So what things they have given? First thing is we have to take the presenting complaint. Second, we have to again observe. We have to see, we have to hear, we can take the smell of unusual characteristic. Third thing, we have to observe the expressions of the patient also. Third thing is that we should not interrupt. And fourth thing is that we should advise him to speak slowly so that you can write it down. So all these 4 points are given in the aphorism number 84. 4. In the 85, he said that the physician should write down all the symptoms separately along with the fresh line, so that जब आपको उसकी और information मिलेगी तो आपको वहाँ पे नीचे आप लिख सकते हो. So every symptom should be started with the fresh line. Then 86. What is given in the 86? What is given?
जेव्हा पेशंटचं सगळं सांगून होते सिम्पटम्स वगैरे तेव्हा फिजिशियननी अनालाइज करायचं आणि जास्त प्रिसाइज इन्फॉर्मेशन त्यांच्याकडून काढून घ्यायचा प्रयत्न करायचा.
बरोबर.
टाइम, मॉडॅलिटीज, ऑनसेट, ड्युरेशन.
बरोबर. So we can revert back to the presenting complaints by asking all such questions की मेडिसिनची हिस्ट्री आहे का, किती वेळ तुम्ही मेडिसिन घेतली, टाइप ऑफ पेन, सेन्सेशन, precise spot for the location, convulsion, feeds, time modality. So you can revert back for the completion of the presenting complaint. आपण का revert back जातो? कारण आपल्याला complete symptom लागतो. What do you mean by complete symptom? Then location, sensation, causation, characteristic of pain and the concomitants. When these 5 components are present, then that symptom became a complete symptom. So we require that, and hence we are again asking the certain questions to the patient, because previously only Dr. Hanuman said, do not interrupt. So patient ka jab ho jayega, so you can ask these questions. What is given in the 87?
We should not take leading questions.
Urvi, just check your connection. माझा आवाज ब्रेक होतोय का?
No ma'am.
Urvi, check your connection. What is given in 87?
Leading questions nahi
Yes,
घ्यायचे.
right. We should not frame the questions which suggest the answer to the patient. When he can give the only yes or no, so this will mislead the patient, this will misleading for the case, and this will not help to find out the medicine. The false picture of the disease will form, and this is an unsuitable mode of treatment. Hence, we should not ask leading questions. Then 88. What is given in the 88?
Particular
Particular symptoms and the mental symptoms. Because why we are considering the particular symptoms? Because we are taking the holistic approach. We have to ask all the questions from head to foot.
Head to foot.
Right. Then in the 89 also he said we have to inquire all the requisite information from the patient except the feign disease. जो भी हमारे पास आता है feign यानी क्या बोलते हैं उसको false disease लेके वो patient को छोड़ के the physician should take all the precise information from the patient. Then what is given in the aphorism 90? एक बार हमारा लिखना होने के बाद अगेन वी हैव टू ऑब्जर्व द पेशेंट कि कुछ हमारा छूट तो नहीं गया है इन द ऑब्जर्वेशन. देन इन द 91 and 92 we have discussed yesterday, we have seen the role of physician in which type of diseases?
Chronic
and acute disease.
Right. Chronic and acute. So we have seen कि chronic अगर है तो पेशेंट को कुछ कुछ जो कैरेक्टरिस्टिक्स रहते हैं दे आर कैरेक्टरिस्टिक, लेकिन वो यूज टू हो जाता है. वी विल नॉट गिव द हिस्ट्री. उसको लगता है कि ये तो नॉर्मल है, दिस इज अ फिजियोलॉजिकल, लेकिन फिजिशियन ने उसको पूरे डिटेल हिस्ट्री लेके वेदर इट इज अ फिजियोलॉजिकल और वेदर इट इज अ कैरेक्टरिस्टिक उसको डिफरेंशिएट हमको करना है, बिकॉज दिस विल हेल्प यू टू फाइंड आउट द मेडिसिन. विदाउट दैट the picture of the disease will not be completed. Then 92 में उन्होंने दिया है serious character अगर है, acute और chronic disease दिया है कि chronic medicine चालू है पेशेंट को लेकिन उसमें उसको acute disease हो गया है. अगर वो वेनरल ओरिजिन है या कोई भी रीजन अगर हो सकता है, सो इन दैट केस ऑल्सो सीरियस डिसीज के लेकर पेशेंट अगर आपके पास आया है, सो वी हैव टू गिव द प्रॉम्प्ट एंड एफिशिएंट एड टू द पेशेंट। जो भी आपके पास सिम्टम्स है उससे आपको डिसीज कंप्लीट करके वी हैव टू कम बैक विथ द सुटेबल होम्योपैथिक रेमेडी। बरोबर आहे? अँड इन द क्रॉनिक डिसीज एक सांगायला विसरले की इथे मेडिसिनची हिस्ट्री आपल्याला विचारायची. इफ इट इज डिसकंटिन्यू, नो प्रॉब्लेम. इफ इट इज कंटिन्यू, वी हैव टू गिव द प्लासिबो विदाउट एनी मेडिसिन. पेशेंट को आपको रखना है सो दैट जो भी उसके साइड इफेक्ट्स है वो धीरे धीरे कम हो जाएंगे एंड देन यू विल गेट द ट्रू पिक्चर ऑफ द डिसीज. क्लियर है यहाँ तक?
Yes, ma'am.
Yes, ma'am.
Now 93. What is given in 93? Again,
मॅम पेशंट अक्यूट डिझीज घेऊन आलेला असतो पण त्याचं क्रॉनिक अफेक्शन असतं.
Why we have to ask the question privately? त्याचा कॉज जो आहे तो वेनरल असतो बरेच वेळा की तो आपल्याला सांगू शकणार नाही. आपण याचे एक्झाम्पल्स बघितले होते ना. इन दॅट केस वी हॅव टू आस्क द क्वेश्चन सेपरेटली. त्याच्यानंतर इन द क्रॉनिक डॅन दिस कंप्लीट अबाउट द अक्यूट डिसीजेस. अक्यूट डिसीजला कसं ट्रीट करायचं, सिव्हिअर डिसीजला कसं ट्रीट करायचं इन द अक्यूट फॉर्म. आणि अक्यूट डिसीज वेनरल ओरिजिन असेल किंवा काही इन्फॉर्मेशन तो आपल्याला देत नसेल तर वी हॅव टू आस्क the personal history of the patient properly. Now about the chronic disease. Chronic disease मध्ये आपण काय काय विचारतोय ना, additional points are here because आपण आधीच बघितलंय काही aphorisms मध्ये की we are differentiating the acute and the chronic diseases. So what are the points of differentiation in the acute and chronic diseases? Occupation we are taking extra. We are taking the mode of living and diet. We are taking the domestic situations, extra things. And we are then scrutinize it, then we have to ascertain the medicine. So these are the extra points that we are considering in the chronic disease. Then what is given in the 95? Again here he has given about the acute disease, how it is helpful for the physician to find out the medicine because Q है नहीं सॉरी, इसमें दो पॉइंट्स दिए हैं कि क्रॉनिक में पेशेंट को यूज टू हो जाता है, फैमिलियर रहता है, वो पॉइंट्स इसमें है. 96 में हाइपोकॉन्ड्रिक पेशेंट का दिया है कि हु इज हैविंग टेंडेंसी टू फॉर्म द विविड कलर्स ऑफ दैट पर्टिकुलर डिसीज. सो उसको हमको अच्छे से हैंडल करके उसको मेडिसिन देना है. वो भले एग्जैगरेट कर रहा हो लेकिन हमको उसको हैंडल अच्छे से करना है. 97 में हाइपोकॉन्ड्रिक के अपोजिट पेशेंट दिया है हु इज हैविंग द इंडोलेसेंस एंड फॉल्स मॉडेस्टी है, उसको शाय पेशेंट है या फिर वीकनेस ऑफ माइंड है तो उसको धीरे धीरे वो याद करता है. तो इन दैट केस आल्सो वी हैव टू बी हैंडल इट प्रॉपर्ली. 98 में व्हाट दे हैव गिवन, वी हैव टू आस्क द सर्टेन क्वेश्चंस टू द फ्रेंड्स एंड अटेंडेंट जो भी उनके साथ आए हैं सो दैट द कंप्लीट पिक्चर विल form. In the 99, what he has given?
Advantage of acute disease.
Right. From the 100 aphorism, he has started the epidemic disease. So 100 and 101 में उन्होंने दिया है genus epidemicus. That is a medicine that we are finding out on the basis of the examination of the several patients, and if the totality is matches with all the patients, then we are finding out the one medicine that can be a remedy for the people, and that is known as genus epidemicus. Okay, clear? So 100 to 104 they are regarding epidemic diseases. Clear now?
Yes, ma'am.
Yes, ma'am.
अभी इसमें से कुछ पूछना है किसी को?
No, ma'am.
ठीक है. So we will take a small class test on the case taking on Monday.
Okay, ma'am.
सबको पॉसिबल है ना?
हाँ, ma'am.
So on that day I will give you the questions and you have to write down and you have to submit it within 1 hour. कमी देईल आहे तसं, फार काही देणार नाही, एका तासात जेवढं लिहिणं होईल तेवढंच देईल. तुमच्याकडे काही बुक्स आहेत का वाचायला?
एकच आहे, ma'am.
आहेत काही बुक्स? थांबा मी देते. बुक्स आहेत का कोणाकडे?
No, ma'am.
आहेत ना, मग तुम्ही वाचू शकता ना, म्हणजे हे की स्क्रीनशॉट घ्यायचा आहे सगळ्या अफोरिझम्सचा.
मैम स्क्रीनशॉट बुक नहीं है.
वेट देऊ का मग आधीपासून एफोरिझम्स परत की लिया है आपने?
यस मैम, नहीं लिया है.
हाँ ले लो, अप टू द एफोरिज्म 86 तक ले लो स्क्रीनशॉट. हो गया?
यस मैम.
एक सेकंड ना. नाइन्टी तक ले लो, 87 to 90.
लिए
91, 92. (93 to 96).
यस.
97 to 100. (101 to 103).
यस
And 104.
थैंक यू मैम.
Okay. So now this meeting will over. Rejoin within 2 minutes. ठीक है? Why all the students are not joining? Where they are busy? Vallabh is not here. Deepak is not here. Komal is not here. Why all the students are not joining?